How to avoid surprise hospital bills with Medicare Part A. Imagine walking into a hospital expecting coverage and leaving with a hefty bill you didn't see coming. That can happen if you're not careful with Medicare Part A. Let's talk about how to keep surprises at bay and stay within your budget. First, understand what Medicare Part A covers. It mainly pays for inpatient hospital stays, including semi-private rooms, meals, general nursing, and other hospital services. It also covers some care in critical access hospitals and certain skilled nursing facilities after a hospital stay. But remember, you are responsible for some costs like deductibles and coinsurance. Medicare sets limits on these amounts, so you won't be hit with unlimited charges. Next, always choose hospitals and providers that accept Medicare assignment. When a provider accepts assignment, they agree to accept the Medicare-approved amount as full payment. This means they won't bill you more than what Medicare pays. If they do not accept assignment, they can charge up to 15% more, but they must bill Medicare first and tell you about any extra costs upfront. It's also important to know your rights against balance billing. Medicare protects you from surprise bills from out-of-network providers for covered services. If a provider does not accept Medicare, they are required to inform you in advance and give you a written notice explaining your financial responsibilities. Always ask before receiving services if the provider accepts Medicare assignment. The No Surprises Act offers protections for many private insurance plans, but Medicare has had rules in place since 1997 to prevent surprise bills. If you get care from providers who do not accept Medicare, they must have a private contract with you that states Medicare will not pay for those services. After your hospital stay, review your Medicare Summary Notice carefully. It lists all services billed and what Medicare paid. Check it for any unexpected charges or non-covered services. If you see something wrong, contact Medicare or your state health insurance assistance program right away. They can help you understand your bill and fight improper charges. Before going to the hospital, confirm that the hospital accepts Medicare. Ask if all the doctors and specialists involved in your care accept Medicare assignment too. Keep records of all your bills and communications. If you are transferred between facilities, verify coverage and participation at each location. By choosing hospitals and providers that accept Medicare assignment, understanding your coverage, reviewing bills carefully, and seeking help when needed, you can avoid surprise hospital bills. Medicare's rules are designed to protect you from unexpected costs and keep your health care affordable.